Welcome back to the lecture series on repertories. Today we are going to see the topic symptoms, rubrics, symptomatology and how to convert the symptom into rubric. Now first we'll see what is a symptom. The word symptom has been derived from the word symptoma, which means anything that happens. A symptom can be defined as an external expression of the internally deranged vital force. These are the evidences of the disease. Morbid derangement makes itself known only by its manifestation. At first, in the form of altered sensation and functions, and later in structural or organic dysfunctions. Thus, a symptom can be defined as an alteration of sensations and functions or any manifestation of a deviation from a former state of health perceptible by the patient, the individual around him or the physician. The symptom now. The externally expressed manifestation may be observed by the patient himself, his relatives, the doctor, or through the laboratory and other mechanically aided investigations. According to Dr. HAHNEMANN, the change in the health of the body and of the mind, morbid phenomena, accidental symptoms, which can be perceived externally by means of the senses. That is to say, he noticed only the deviation from the former healthy state of now deceased individual, which are felt by the patient himself, remarked by those around him, and observed by the physician. According to Dr. Kent, every symptom is indicative of a deviation from the normal state of health. According to Dr. Stuart Close, in general, a symptom is any evidence of disease or a change of state of health. According to Dr. Deve, a symptom is the expression of disturbance in a healthy body produced by a drug or some morbid agents. According to Dr. Wright, symptom to the homeopaths are the language of body, expressing its disharmony and calling for the similar remedy. Any perceptible change in the body and its functions, either subjective or objective, which indicates disease of the kind or the phase of the disease. Webster's Dictionary. Now we will see what is a rubric. The rubric word originated from the Latin word rubrica. In the repertory, rubrics and sub-rubrics are placed in each chapter as headings and subheadings respectively, with a single remedy or list of remedies under them. The definition of rubric. Rubrics are the converted form of the symptoms into repertorial language in which a long sentence is expressed by few words with proper arrangement according to the concerned repertory. Arrangement of the rubrics now we'll see. Rubrics are arranged alphabetically under each and every section in different repertories. For example, skin section, adherent, anesthesia, bed sore, biting, callus, cancer. Conversion to rubrics should be done without compromising the meaning of a symptom. For that, we can split the symptoms as much as possible to convert each part into rubric or sub-rubric, but in whichever way it is read, should convey the exact meaning as that of the original symptom. In concordance repertory, there is no need of the conversion as the symptoms are represented in prover's language. Rubrics have to be studied according to a definite plan of construction based on the philosophy of the author, which varies from repertory to repertory. The rubrics are classified into general rubric on main rubric, then sub-rubric, then sub-sub-rubric, sub-sub-sub-rubric. First we will see the general rubric. These are the main headings or main rubrics given under different chapters, which are mentioned as side headings, and usually it contains large number of medicines. General rubrics are usually not modified by sub-rubric like site, time, character, extension, etc. Dr. Kent states that while repertorizing, first work out the general rubric followed by particular rubric to avoid missing a simillimum. Now we will see the sub-rubric. These are the subdivisions of rubric so that they are mentioned under the main rubric and they modify or qualify the main rubric, and mostly it contains less number of medicines than the main rubric with few exceptions. The sub-rubrics always differentiate the remedies with particular components such as location, sensation, modalities, concomitants, extension, onset and pathology. We will see an example. Symptom, for example, throbbing type of pain in head relieved by pressure. The rubric, pain. Sub-rubric, pulsating or throbbing. Then pressure amelioration, head section in Kent's repertory. Second one, symptom. Patient has fear of death when alone. The rubric, fear. Sub-rubric, death. Sub-sub-rubric, alone when. Mind section, Kent's repertory. Rubrics are usually written or printed in special lettering. Sub-sub-rubric, now we'll see. These are the subdivisions of sub-rubrics, which gives further explanation to narrow down to specific remedies by differentiating the remedies in the main rubric. Subdivisions of sub-sub-rubrics are called as sub-sub-sub-rubrics and so on. Now we'll see the, for example, head chapter. Pain is a general rubric. Weather is a sub-rubric. From change of. Cold, damp cold. Warm begins with the. These are the sub-sub-rubric. Now we will see the types of rubrics. Similar rubric, particular rubrics, pathological rubrics, clinical rubrics, diagnostic rubrics. Then comes the eliminating rubric. Now we'll see the similar rubric. These are rubrics that resemble each other or corresponds in meaning. The physician should select the right choice after comparison of both while converting the symptoms into rubric. For example, in Kent's repertory, mind, speech, and mind talk, then mind thinking and mind thoughts. Now we will see the particular rubrics. Rubrics related to a part or organ are called as particular rubrics. These are nothing but the sub-rubrics that mentions with the result of modification of rubrics either by site, time, modalities, extension, location, character of sensation, and many other factors. Now we'll see the example. Pain, forehead, amelioration by pressure. This rubric carry limited number of remedies deducted from the general rubrics. Such rubric gives smaller number of remedies, so useful for proper selection of remedy. Now see some examples from BBCR. For example, eye conjunctiva, hypochondria, spleen. Now we will see the pathological rubrics. Rubrics that represent any pathological changes or conditions are called pathological rubrics. For example, in BBCR, in chapter Sensation and Complaints, in general, atrophy, Sensation and Complaint chapter, in general, suppuration. Now we will see what do you mean by clinical rubrics. The rubrics related to clinical conditions are called as clinical rubrics. For example, we will see the example: nose, internal nose, bleeding, epistaxis. Then female sexual system, hemorrhage or metrorrhagia, nervous system, sciatica. Now we will see the diagnostic rubrics. The name of the diagnosed disease itself is rubric and only represents the remedy that are frequently used for treatment of the disease. For example, in Borik's repertory, generalities, Addison's disease, then nervous system, inflammation, meningitis, throat, diphtheria. Now we will see the eliminating rubrics. It is a rubric that is selected for elimination cases of repertorization. The most prominent symptom of the patient be considered for choosing eliminating rubric, as all other which do not cover the eliminating rubric are all eliminated. Now we will see the symptom and rubrics comparison. Now we will see the symptomatology. First we will see the subjective symptoms. Subjective symptoms are those which are felt by the patient himself. They enable the physician to view a disease from the standpoint of the patient. Homeopathic concept of disease holds that the disease originates first at the dynamic plane and latter causes deviations in the normal sensations and functions. So, the subjective symptoms are those which the patient feels and speaks about and communicated to the physician. The physician may not know these symptoms unless told about them. These are of the patient's own consciousness. Among them are all the varieties of pains and abnormal sensations which accompany the disease condition. Subjective symptoms can be of mind or of the body. These symptoms were previously disregarded and are still considered as of no value by the so-called rational or modern school of medicine. These symptoms are of essential value in homeopathic therapeutic because it is mainly these symptoms which depict the intrinsic nature of the case or the drug. Subjective symptoms. The deviation and alteration at the level of sensation and functions indicate a primitive stage of the disease which the patient alone can feel. The patient feels that he cannot function efficiently. He feels that something is wrong with him. Slowly he discovers that these are various unwanted sensations or changes in his functioning. These changes denote the subjective symptoms. In fact, these symptoms are available much before the actual disease localizes itself in a particular system or organ. If the patient approaches a homeopathic physician at this stage of disease, the disease can be aborted with the help of medicine selected on the basis of subjective symptoms alone. Stuart Close writes that the subjective symptoms constitute the only direct avenue of approach to the inner sphere, which must otherwise remain close to our investigations. The subjective symptoms. Everybody knows that pains and various sensations are different from those of health, makes up a large and important part in every case of illness. Every physician and intelligent person knows by observation and experience that pains and abnormal sensations almost always precedes and any material or organic evidence of disease. The first evidence of nearly all disease consists of subjective symptoms. A method, therefore, which does not provide for the employment of these symptoms in the determination of the treatment, cannot furnish means for encountering disease at the very outset. All types of pain, discomfort, various sensations, and mental symptoms come under the domain of subjective symptoms as expressions of the interior state of the organism. They take the highest rank. Now we'll see few examples. Burning sensation anywhere, throbbing or stitching type of pain in the chest. These symptoms can be considered under general or particular or common. Now we will see objective symptoms. Objective symptoms are those which are perceptible to the patient, bystanders, and physician. They are also known as signs. These perceptible changes are sure signs of disease and do not mislead the physician. Mostly, this type of symptoms follow the subjective symptoms, that is, functional and sensational disturbances. They become the most important guide in infants, unconscious patients, insane, deaf and dumb patients, patients with a different language, and even in uncooperative patient. The physician derives a knowledge of these symptoms by the use of his own senses. For example, by sight, touch, hearing, smell, taste, percussion, and by microscopic and chemical examinations. These symptoms can be seen by the patient himself or others who attend on him. These symptoms are of less value for exactly identifying the individual patient. They are rather of more value for identifying the nature of the disease. These symptoms are more common in various patients suffering from the same disease, and they are grosser manifestation of more advanced stages of disease. These symptoms characterize the disease more than they characterize the individual patient, but they are of great value in authentically ascertaining the nature of the disease and its changes in the course of the treatment. A case cannot be taken as radically cured, however much the subjective symptoms have disappeared, or even however much the patient feels well, so long as the objective symptoms like intermittent fever with enlarged spleen and liver. In case of malaria, then comes the high sugar percentage in blood of a case of diabetes have not disappeared. Many subjective symptoms are obviously manifested externally, observed by others, and so have some objective quality. For example, chilly feeling manifested by goose flesh, shivering, demand for covering or heat, etc. Greediness by excessive flow of saliva and or licking of lips, thirst by dryness of mouth and tongue, anger by frowning with redness of eyes and face, shyness by blushing of face and ears, burning sensation of a part by tendency for cold application or for exposing the part to open air, pain in any part of ear, abdomen, etc. By placing the hand over there, colic, as in babies, by flexion of the thighs over abdomen, and so on. Vice versa. Many objective symptoms or signs have obvious subjective significance. For example, facial expressions, an objective sign representing various subjective symptoms, feeling of well-being, then pain, worry, agony, etc. Redness with throbbing of arteries, representing throbbing or pulsating, pain in the corresponding part, crying of the baby with hands on particular parts signifying pain in corresponding part, and so on. Objective symptoms are valuable in cases where subjective symptoms cannot be obtained or relied upon, such as in the unconscious, insane or imbecile patients and in children. Now we see some examples: ulcers, boils, swelling, etc. Then dysfunction of the heart or any organ of the body, then sugar in the urine, blood changes. These symptoms can be considered at times in physical journal, otherwise they are common. Now we will see common and uncommon symptoms. First, common symptoms. Common symptoms are those which are common to any patient suffering from a certain disease or complaint. They are of least importance because they will be found in almost every drug or disease in one form or the other. Or common symptoms are those which are present in many persons suffering from the same ailment. For example, breathlessness is a common symptom in acute exacerbation of asthma. Headache and body ache are common symptoms in a case of fever. These symptoms are very helpful in diagnosing a case because they are pathognomic. They do not help in individualizing a person. Hence, they are not very important for prescribing in the homeopathic system of medicine unless they are further qualified. However, they help us to arrive at a group of medicines. Common symptoms help us to know the uncommon symptoms. Common symptoms becomes useful when they are absent, intense, associated with other symptoms, present in a group, traceable to indicate origin, duration and progress. Common symptoms must be considered last in hierarchy of symptoms and study of repertory, be they general or particular, mental or physical. Now we will see the uncommon symptoms. Uncommon symptoms are those which draw our attention because they stand out in a group of symptoms. They are also known as characteristic symptoms. They help in individualizing a person since they are the expressions of person and they have little to do with the existing pathology and disease. They have little importance in arriving at a diagnosis. They are the expression resulting from the total response of a person interacting with unfavorable circumstances. These symptoms help the physician to understand the constitutional qualities of the individual. They rank very high. The qualities of the symptom described by HAHNEMANN as striking, singular, peculiar all belong to this category of symptom. Now we will see the general and particular symptom. First, general symptom. All the symptoms that are predicted of the patient himself are called generals. These symptoms give information pertaining to the whole patient. The things for which the patient says, I feel, are apt to be general. Kent has given various examples of generals in his lecture on homeopathic philosophy. For example, I am thirsty, I feel hot, I am sleepy, I hate cold, I hate fat, etc. Generals are expressions of the whole person at the physical and mental level. Generals are sometimes also made up of particulars. When a certain symptom runs through all the particulars, it becomes a general. A common sensation found at two or more than two locations also becomes a general. The general symptoms can be divided into mental general and physical general. First, we will see mental generals. The whole of homeopathy revolves around mental symptoms. All mental symptoms are to be classed as generals because they reflect the inner self of innermost part of man and the individuality of the patient. This includes expression available at an emotional and intellectual level. One should note that emotions provide greater force to an individual, and any change in the emotional sphere is considered as the most important symptom of the person. This relates so intimately to the man himself. To quote Kant says, when a person arrives at a state where he has an aversion to life, we see it as a general symptom that permeates his economy, that qualifies all the symptoms and is the very center of all his states and conditions. While considering the mental symptoms, the symptoms of emotions and intellect should be both taken into consideration in the following order. First comes the will, which includes elements from anger, bad news, grief, love, joy, reproach, hatred, irritability, jealousy, symptoms of love, hate, anxiety, fear, etc. Then comes perversion of understanding. It includes delusion, hallucination, illusion, ideas, thoughts, confusions, then disturbance of formulation. A few symptoms given in the repertories like absorpt, clairvoyance, confusion, dullness, comprehension, excitement, imbecility, mental activity, elements from mental exertion. The third one is a perversion of memory, memory loss of, then absent-mindedness, etc. Now we will see the second one, physical general. These are the symptoms which are referring to the body as a whole with regards to various physical conditions or circumstances. Symptoms involving the whole person at a bodily level are to be considered in the following order. Perversion of the sexual sphere. Then comes the including relation to the menstruation. Then elements from food, craving and aversions, weather and climatic influences. Then comes the sleep. Then general modalities, position, motion, periodicity, moon phases, etc. Now we will see the particular symptoms. All the symptoms that are predicted of any given organ are particular symptoms. They are symptoms which pertain to the part and do not represent the whole person. The more they relate to the anatomy of a part, the more they become unimportant for homeopathic prescribing. They become important when they are qualified or marked with intensity, or when they are found in unusual situation modifies make a particular symptom important. Though particular symptoms are not given much importance in erecting a totality, Bonninghausen has attached great importance to this symptom since they are easily and surely available. Undoubtedly, they are very important while dealing with acute complaints. Characteristic particulars do help in finer differentiation of the remedy in a well-defined group of remedies. They also act as keynote prescribing symptoms when generals are lacking in a case. Common particulars are not very useful in homeopathic prescribing. Now we will see the complete and incomplete symptoms. First we will see the complete symptoms. Complete symptoms are symptoms which have the element of location, sensation, and modalities. These three elements are also called the components of a symptom. The idea of a complete symptom was first introduced by Bonighasan, who, while going through the Materia Medica Pura and chronic diseases, noticed that a majority of symptoms did not have modalities. In order to understand the symptom, it is necessary that all the elements, that is, location, sensation, modalities, and concomitants, should be known. Therefore, it is necessary that all the elements should be looked for and noted down while taking a case. It is found that very often it is the modality which is lacking in description. In a modality, the elements of amelioration is generally not available. Even in homeopathic materia medica or repertories, we find that the ameliorations have not been given much importance. In practice too, one can observe that patients do not mention the relieving factors, but always describe the aggravating factors. Complete symptoms not only help in understanding of a case, but also helps in repertorization by Bonighasan's approach. Now we will see what do you mean by incomplete symptom. Incomplete symptoms are those which lack any one or more of the three elements, location, sensation, and modalities of a symptom. Bonighasan had devised a method to overcome this deficiency in a symptom. He has advocated that if one element is missing in a symptom, it can be taken from another symptom to complete it, that is, one modality or sensation could be applicable to all the parts or the whole person. This idea is known as the principle of grand generalization. Now we will see the chief and concomitant symptoms. First we will see the chief symptoms. Chief symptoms are those which compel a patient to seek the help of a physician. The patient mentions it first in a case-taking session. In a majority of the cases, chief symptoms are described in detail and physicians do not face any problem in detecting them. Most of the time, these symptoms are common symptoms and they help the physician in the diagnosis of the case. Chief symptoms are also known as presenting complaints. Sometimes this can be more than one chief symptom in a case. Now we will see what do you mean by concomitant symptoms. Concomitant symptoms are those which are accompanying the main complaint. The word concomitant means existing or occurring together. Attendant. The noun means attendant. Circumstances. They are also called auxiliary symptoms. They do not have any physiological or pathological relation to the main symptoms, but they have definite relationship to the case. These symptoms cannot be explained according to the theories of pathology. Hence, they are sometimes most striking and peculiar symptoms. These symptoms many a time help to individualize the patient and the remedy. Bonighasan was the first to notice these symptoms. For example, cough, main symptom, accompanied by, we'll see, bleeding from the eyes or bloodshot, arnica, pain in the head or at distant part, bryonia, involuntary passing of stool or urine, causticum, etc. Now we will see eliminating symptoms. The eliminating symptoms are those symptoms which throws off all the medicines that are not needed for the patient and brings home only those medicines which are required for the patient. Or eliminating symptoms are symptoms which helps to eliminate some unimportant medicines to facilitate the selection of the simillimum are called as eliminating symptoms. These symptoms are best to start with in repertorizing a case. One should be very careful in selecting a symptom to be used as an eliminating symptom. Eliminating symptoms should preferably be important general symptom. Dr. Margaret Tyler introduced these symptoms in repertorization. Eliminating symptoms to compare with all the subsequent rubrics you consult, from which you can often discard the drugs that do not appear in this first essential list. With this guide, this strong eliminating symptom straight from the heart of the patients, as it were, you can go through the rubrics of the patient symptoms in their order. For example, mentals first, then generals, then particulars, with modalities taking from each list only the remedies that appear in this first rubric. For example, insane, jealousy, or whatever it be, but taking all these jealous remedies from every subsequent list. In this way, you can work rapidly down till you are satisfied that you have found the remedy that fits the patient as a whole. But this means much to eliminate with safety. You must take symptoms seriously, not lightly. You must be absolutely sure that your symptoms are real and marked, that they do actually express the patient. You will have to ask many questions in order to elicit a few telling symptoms, and you must be quite sure that you and your patient means the same thing. There are many pitfalls. Now we will see the keynote symptoms. These symptoms which are peculiar in a case and helps to find out a small group of remedies are called keynote symptoms. This should be at least 3 keynote symptoms in order to make a correct homeopathic prescription. The 3-leg stool of Allen. It was Dr. Gunsey who highlighted the importance of these symptoms in homeopathic practice. Later, many other great prescribers like Dr. Lippe, Wells, Allen, etc. have given importance to keynote prescribing. Keynote prescribing was more in practice before the advent of reliable repertories. In fact, all keynote symptoms cover a good number of remedies, and one should refer to repertories to verify the prescription. True keynote symptoms, if 3 or more, cover the entire totality of a case. Stuart Close defines a keynote as a minor generalization based upon the study of many particulars. A keynote might be one of the characteristic particular or generals. Keynote symptoms, or this keynote system of prescribing is highly attractive to many minds because it looks so easy and does always with all tedious comparison of drugs, and also from the fact that many brilliant cures were made by means of the keynotes in the hands of Lippe, Allen, and other advocates of the system. But you must remember that these men, as well as any other who have been successful with keynote, have had a keen enough perception into totalities and the pathogenesis of remedies, so that they use the keynote which was not ruled out by the contradicting general symptoms of the patient. Many of the so-called keynotes are both generals and particulars, aggravation from motion of bryonia and sore bruise sensation of arnica. This so-called keynote systems of prescribing is very attractive, as it seems so easy and saves all the laborious comparisons of competing drugs that are involved in numerical methods, and also because by means of it many brilliant cures have been made, but it is from its very nature a wrong method, and in the large majority of cases is doomed to failure because it ranks one or two symptoms very high and practically ignores the others. Now we will see the basic or absolute symptoms. First we will see the basic or absolute symptom. Basic symptoms are those that appears in every proving and disease and are of general nature, which are usually important for diagnosis. They are of little value to determine the specific homeopathic drug indicated, but taken through furnish suggestive beginning. Such symptoms are malaise, headache, weakness, fever, pain, anorexia, etc. Basic symptoms which are essential for understanding the disease condition and are found in almost all provers without any characteristics are called basic symptoms. They are equivalent to common symptoms. They are also known as generic symptoms. These symptoms can be considered as a common symptoms. Pathognomic symptoms have no value in repertorization unless they have modalities. Now we will see determinative or non-pathognomic symptoms. These are the strange, rare or peculiar symptoms of the patient or of the drug. They form the basis for repertory and mathematical study. They are individual or personal ones if found in a patient, or characteristic or keynote if found in a drug's pathogenesis. By determinative symptoms, we distinguish drugs as well as disease individual. The symptoms which help to find out or select finally an indicated remedy are called determinative symptoms. The term was used by Dr. Garth Borick. Borick's determinative symptoms are equivalent to Kent's characteristic symptoms. They consist of mental symptoms, modalities, rare, strange and peculiar symptoms, qualified basic symptoms. These symptoms are general and qualified particulars. Now we will see pathological symptoms. Pathological symptoms are those symptoms that pertain to the ultimates or result of diseases. They are basic symptoms, but when we come across pathological generals such as tendency to warts, tendency to bleed, tumors, etc., such reflect the trend of the organism and therefore are to be considered. When a common pathological feature exists at two or more than two locations. The feature is known as pathological general. They are important for prescription by Dr. Bogar's approach. For example, tumors, warts, anemia, hypertension, etc. At times, these are included in physical gender, otherwise they are common. Now we will see the clinical symptoms. According to the orthodox school, these are the symptoms which a physician standing at the bedside of the patient perceives directly with his senses, unaided or aided by suitable instrument, or which are communicated to him by the patient or his attendants. Symptoms which are common in a disease condition are called clinical symptoms. Clinical symptoms of a drug represent symptoms which are not found during the proving of the drug, but were found to be cured in clinical practice. In homeopathy, we observe that clinical symptoms has not been observed in the proving of a remedy, but which, as distinct symptoms of a case of a disease, disappears on the employment of that remedy for other purpose, is said to be its clinical symptom. Clinical symptom is one which is not caused but cured again and again. Our Matra Medica includes many clinical symptoms. It is to be assumed that had the proving been extensive enough, such a symptom would have been produced. These are third grade symptoms, and it cannot be included in mental or physical general or particulars. Now we will see the alternating symptoms. At times, the clinical record indicates two groups of symptoms which keep alternating with each other. This indicates alternating group of remedies. The classical example being that of Rustox and Bryonia in the treatment of typhoid. However, when a similar situation occurs in a chronic case, when apparently unrelated complaints alternate, perhaps in different reason, or the one appears when the other is ameliorated, a special note of this alteration has to be made and an appropriate reference made to the repertory. According to KED, a successful prescription is impossible unless this feature is taken into consideration. Prescribing two sets of remedies for alternation is not the right way to treat the case. These symptoms are classed as strange, rare, uncommon, peculiar, and striking. Now we will see the accidental symptoms. Symptoms which are found prominently in a person but do not fit into the totality are known as accidental symptoms. These are present by change and do not help either to understanding the phenomena of disease or in forming a totality. It is safe to ignore these symptoms after weighing them properly. Now we will see the paradoxical symptoms. Symptoms which are self-contradictory and opposite in nature but are found together are called paradoxical symptoms. For example, sleepy but cannot sleep, throat pain better by swallowing solid food, etc. These are also known as contradictory symptoms. Now we will see periodical symptoms. Symptoms which return at a fixed interval are called periodical symptoms. These symptoms are helpful in finding out an indicated remedy. They are given a good representation in most of the repertories. Now we will see the recurrent symptoms. Symptoms which return at frequent intervals are called recurrent symptoms. These indicate the tendencies and constitutional dyscrasias of the individual. See the alternating symptom. Symptoms which manifest the partial picture of a chronic disease in one phase and are replaced by some other manifestation later are called alternating symptoms. Knowledge of these symptoms helps us to obtain the complete picture of a chronic disease. Now we see the negative symptoms. Symptoms which are expected to be present in a case but remain absent are called negative symptoms. They become valuable by their conspicuous absence. For example, absence of thirst in fever, absence of pain in inflammation, etc. Diagnostic symptoms. Symptoms which are important for diagnosing a case are called diagnostic symptoms. These symptoms are the product of a disease and not very helpful in homeopathic prescribing. They are also known as ultimates, pathological and common symptoms. Now we will see how to convert patient symptom into rubrics. For example, symptom. He had a headache at the same time in the morning every other day. The rubric will take head pain, periodic headache every other day. The remedy is cetron. Second one, symptom. Her entire mouth felt as if it were burned. It were burned inside. Rubric, mouth pain burnt as if. The remedy is iris versiculosis. He could not stand when people dawdled and was always telling everyone to hurry up. The rubric is mind, hurry, everyone must hurry. The remedy is tarantula. Symptom. Her nose ran whenever she sat on the toilet to the stool. The rubric is nose, coryza, stool during. The remedy is thuja. Then comes the rubric mind, moaning, sleep during. The remedy is aurum. Next symptom. He suffered from a slowly progressing paralysis of his right arm. The rubric, generalities, paralysis, gradually appearing. The medicine is causticum. Next symptom. The baby would not stop crying unless it was carried. The rubric, mind, carried desire to be. The remedy is chamomilla. Symptom. He had an excruciating pain in his testicles which he said felt as if they were crushed. The rubric, genitalia, pain, crushed testes. The remedy is rhododendron or argentum metallicum. The symptom. She had a cramping pain in her stomach which felt better after putting heating pad on it. Rubric, stomach pain, warm application amelioration. The remedy is Macphos. The symptoms, he said, he felt something moving in his belly. The rubric, abdomen movement. The remedy is thuja or crocus sativus. Symptom, she was hard of hearing, but said she heard better whenever there was noise in the background. The rubric, hearing impaired, noise, amelioration. Remedy is graphitis. Symptom, he complained that no one appreciated him or thanked him for all that he did. The rubric, mind, longing, good opinion of others. The remedy is palladium. Symptom, the sweat on his scalp had a sweet smell. The rubric, head, perspiration, scalp, honey smelling like. The remedy is thuja. The next symptom, she had a toothache that was worse whenever she drinks coffee. The rubric, teeth pain, coffee from. The remedy is chamomilla. Symptom, she had a bad case of menstrual cramping and said the only thing that relieved was the pain was drinking coffee. Rubric, abdomen, pain, coffee, amelioration. The remedy is colocin. Symptom, he was very worried about his heart and said he felt as if it was about to stop beating. The rubric, chest, seizes sensation as if heart would. The remedy is lobelia. Symptom: he had the flu, but looking at his face, you would have though he was drunk, as if he was looking drunk. The rubric: face, expression, be sorted. The remedy is baptisia. Symptom: she had a case of cystitis and said each drop of urine burnt like fire. The rubric is bladder pain, urinating during, after few drop pass. The remedy is cantharis. Next symptom: he had an empty hungry feeling every morning about 11. Rubric: stomach emptiness 11 am. The remedy is sulfur. Next symptom: she was afraid that she would be caught outside in a storm and be struck by lightning. The rubric is mind, fear, thunderstorm, afraid of. The remedy is phosphorus. Symptom: his back was weak and he noticed the problem especially after having sex with his wife. The rubric: back, weakness, emission from. The remedy is selenium. Symptom: she would start coughing whenever she laughed. The rubric: cough, laughing. The remedy is china. Symptom: when the doctor asked him to stick out his tongue, it trembled. Rubric: mouth, trembling tongue. The remedy is lachesis. Next, the rubric: teeth bite, wants to be on something hard that relieves the pain. Dentition. The remedy is phytoleca. Symptom: she had a case of mastitis in her right breast. A stitching pain extended from the breast to her back. Rubric: chest, mammary pain extending to back. The remedy is phalandrium. Symptom now: ever since he hit his head in an accident, he had difficulty in concentrating. The rubric: mind, confusion, injury to head. The main remedy is natrum salt. The symptom: the base of her tongue had a yellow coating. The rubric: mouth, discoloration, tongue, base, golden yellow. The medicine is natrum phos. Symptom: she could not fall asleep as she recalled the circumstances of her divorce several years ago. The rubric: sleep, sleeplessness, grief from. The remedy is natrum mur. Next symptom: he had a constant urging to go but could not pass nose to. Rubric: rectum, constipation, constant desire. The remedy is naxomica. Next symptom: she had nightmares whenever she slept on her back. Rubric: sleep, dreams, nightmare, lying on the back. The remedy is sulfur. Symptom: he had headache that lasted for 2 or 3 days. The rubric: head pain, constant, confused or continued 2 or 3 days. The remedy is ferrum mate. Next symptom: her headache were better after she urinated. The rubric: head pain, urination, profuse, amelioration. The medicine is gelsemium. Next symptom: he fainted in the warm, stuffy room. The rubric: mind, unconsciousness, warm room. The medicine is pulsatina. Next symptom: his urine was passed in 2 separate streams. The rubric: bladder, urination, fork streams. The remedy is thuja. The symptom: she said she had chills running up and down her spine. The rubric: back, coldness, up and down the back. The remedy is gelsemium. Symptom: he had the flu and did not drink very often, but when he did, he drank a great deal of water. Rubric: stomach, thirst, large quantities for long intervals at. The remedy is bryonia. Symptom: she woke up every night from the force of the heartbeat. The rubric: sleep, sleeplessness, palpitation from. The remedy is Oramur. Symptoms: he was heartbroken when since he broke up with his girlfriend and said could feel his heart beat loudly in his chest. The rubric: chest palpitation, grief from. The remedy is digitalis. Next symptom: she said that she could feel water splashing back and froth in her stomach. Rubric: stomach, water, sensation as if full of. The remedy is oleum A. Next symptom: he would take a dislike to other people for inconsequential reasons or even no reason at all. The rubric: mind, aversion, persons to certain. The remedy is natrum car. Next symptom: his job was to absorb a sheep and he had asthma that was worse whenever he came ashore. The rubric: the respiration, asthmatic, sailors, as from. The remedy is bromium. The symptom: she had epilepsy and her convulsions occurred during her menses. The rubric: generalities, convulsions, menses during. The remedy is oenanthes. Next symptom: she sighed repeatedly as she told the unhappy story of her life. Medicine you will find is the mind, sighing. The remedy is ignitia. Next symptom: he spoke with his dead parents as if they were still alive. The rubric: mind, delusions, talking as with dead people. The medicine is Calcarea silicata. Next symptom: the children came down with a diarrhea just before they were going to go to the movies. The rubric: rectum, diarrhea, excitement, or before theatre. The remedy is argentum nitricum. Next symptom: she took off all her clothes and ran naked down the middle of the street. The rubric: mind, naked, wants to be. The remedy is hyoscyamus. Next symptom: she did not like eating anything sweet. Rubric: stomach, aversion sweets. Or remedy you will find is a graphitis or causticum. Next symptom: he was impotent and said his penis felt shrunken and cold. The rubric: genitalia, erections, wanting, penis small and cold. The remedy is agnus castus. Next symptom: his cough was worse when he undressed. The rubric: cough, uncovering, aggravation. The remedy is rumex. The next symptom: while taking the case of a woman with arthritis, the symptom that stood out was her strong craving for apples. The rubric: stomach, desire, apples. The remedy: guaiacum. Symptom: he cared about other people's problems, even if they were strangers. The rubric: mind, sympathetic. Remedy is phosphorus. Next symptom: she slept on her stomach with her arms raised over her head. The rubric: sleep position, arms overhead or on the abdomen. The remedy is pulsatilla. She always came down with an attack of diarrhea before her menses. The rectum, diarrhea, menses before. The remedy is bovista. Symptom: he had a bad case of writer's cramp. The rubric: extremities, cramps, hand, writing. The remedy is McFoss. Symptom: she liked to eat green and unripe fruit. The rubric: stomach, desire, fruit, green. The remedy is Midorinum. Whenever he drank anything cold, it made his stomach feel like ice. The rubric: stomach, coldness, ice-like. After cold drinks, the remedy is elapse. The baby wasn't gaining weight and had a discharge from the navel. The rubric: abdomen, discharge from the umbilicus. The remedy is abrotanum. Symptom: he had a red streak down the center of his tongue. The rubric: mouth, discoloration, red streaks down the center. The remedy is veratum viridi. Next symptom: her throat was sore first on the left side, then the right, then back of the left. Rubric: throat pain, sore, alternating sides. The remedy is Laccan. Next symptom: her labor was delayed because her cervix did not dilate. The rubric genitalia, female, rigidity of os during the labor. The medicine is colophylum. Next symptom. His anxiety was better when he lays down in the evening in bed. The rubric mind, anxiety, evening bed in amelioration. The remedy is macabre. Next symptom. She suffered from terrible nausea and the only thing that could relieve it was the fresh air. The rubric stomach, nausea, air in open amelioration. The remedy is tobacco. Next symptom. He had the sensation of worms crawling under the skin. The rubric generalities, worms under the skin sensation. The remedy is cocaine. Next symptom. When she said her cold, she was constantly sipping a drink. Rubric stomach, thirst, small quantities for often. The remedy is arsenical. The next symptom. The child was shy and would hide behind the furniture when people came to visit. Rubric mind, hide, child thinks all visitors laughs at it and hides behind the furniture. The remedy is Baraitaka. Next symptom. He said there is a dark side of me that wants to do terrible things and a good side that holds me back. Rubric mind, will to. Feels as if he had two wills. The remedy is anacardium. She had a strong urging to urinate whenever she went outside on a cold day. The rubric bladder, urging, cold from becoming. The remedy is dulcamera. After his operation, he suffered from trapped gas in the abdomen. Rubric abdomen, flatulence obstructed. Medicine is Raphanus. She had a constant urge to blow her nose, but there was no discharge. The rubric nose, dryness, blowing nose, compelled but no discharge. The remedy is Sticta. He would wake up in the middle of the night in order to eat. Sleep. You will find waking. Hunger from. The remedy is Lycopodium. Then his cough was better when he drank something. Rubric cup, drinking amelioration. The medicine is Spongia. He had a cold and his eyes were filled with tears, but the tears did not burn or smart his eyes. Rubric eyes, tears, blood. The remedy is Allium cepa. During her sleep, she drooled on her pillow. Mouth, salivation, sleep during. The medicine is Mercurius. He had a thick milky white coating on his tongue. The rubric mouth, discoloration, white, milky. The remedy is Antimonium crude. She had coughing fits that were so severe that her nose started to bleed or his nose started to bleed. Rubric nose, epistaxis, cough fit. The remedy is Drosera. Whenever she swallowed, she felt a pain like splinter in the throat. Throat pain, splinter on. Swallowing. The remedy is Hiparsal. Thank you for listening the lecture on symptoms, rubric, symptomatology, converting the symptom into rubric. If you like the lecture, then please do subscribe and share. Thank you and see you soon with the new lecture.